Right, here comes our police vehicles into the arena. Now the first priority of the police is to secure the scene. They need to close off the road from both directions. This is to keep the scene area sterile, and that is for the safety of the officers attending as well as the casualties that are currently on the road. Once they have secured the scene, the officers will kit up in their high visibility clothing, once again for their protection, and they will start putting some cones out. Some people have asked why are they not going straight to the casualties. It is very important that we keep the area safe. If a police officer gets run over, it is not going to be much help for the casualties. Once they're happy that the scene is safe to work in, their first priority then will be the casualties. We've got one officer who is examining the driver, carrying out some very basic first aid to see if they're responsive to some commands, some pain tests, while another officer is dealing with the patient on the floor. This is now turning into a very serious incident. We've got two people who are casualties. One of them does appear to be very unresponsive. They will now be radioing up to our control to request further assistance. The assistance they'll be requesting is from the ambulance service. I'm now going to be handing over to them.
Hello, good afternoon everybody. So we should have a first response car en route. And they're going to be shortly followed by two double-manned ambulances. We have a paramedic and an ambulance officer here. They're going to make an initial assessment of both the patients.
He's saying that he's got a what have you done to get moved?
So Cassie, the paramedic, is assessing the gentleman who was driving the bus. The bus driver has presented with a left-sided weakness and slurred speech. This is suggestive of symptoms of a stroke. So the crews are going to treat this patient. The gentleman that's been hit by the bus is presenting with a reduced level of consciousness. He appears to have neck and pelvic trauma, so he will be immobilised and removed to a major trauma centre. Basically, we have pathways available to us. That means that we don't delay treatment for the patients and we take them to the most appropriate hospital. So within this area, the gentleman that's been hit by a bus will be treated by us and stabilised as best we can on scene, and then removed to a major trauma centre, the local one, which is St George's in Tooting from here. At the moment we have some immobilisation equipment coming out of the white ambulance, so the patient will be immobilised with what we call our orthopaedic stretcher or our scoop, and then placed onto a vacuum mattress. This basically means that the patient is completely immobilised to basically stabilise his injuries as best we can to ensure a safe transfer to the hospital. The gentleman who's having a stroke, obviously we are aware of the symptoms that strokes can present with. There's been quite an advertising campaign, so things like facial weakness, weakness on one side in the arms, legs, and an inability to speak or slurred speech. So what will happen with this patient is the crew will conduct a fast test, and then we'll priority the patient to the nearest hospital that is capable of dealing with a stroke. So that means treatments such as thrombolysis, that's a clot busting drug to reduce the symptoms or to well, hopefully minimise the damage if they can. As you can see, the crew in front of the bus, they're monitoring the patient. They're using what we call a life pack, which is a heart monitor, and it also does things like blood pressure, acts also as a defibrillator. They've applied a C-spine collar and are extricating this patient onto the trolley so that he can be taken to hospital. The gentleman who is suffering with a stroke, they're just removing him onto the chair, and then they will be pre-alerting the hospital with what we call a fast call. So, as I say, the patient will receive the treatment and get a quick CT scan at the hospital, and obviously minimising the delay of treatment. So the first patient is being removed.
You didn't want to refresh his day, did you? Thank you. Thank you, officer.
Right, might go a little while, but if you guys can
And the second patient that got hit by the bus, as you can see, is being placed onto a vacuum mattress. Basically what we have is a trauma decision tree. As this patient is presenting with the injuries that he's presenting with and a reduced GCS or level of consciousness, he flags up a trauma tree, which means that we would convey to a major trauma centre. Other resources that we have available to us that unfortunately not here this afternoon are HEMS, which are the heli medics. They would have a doctor and critical care paramedic on, so they can initiate other treatment, and also critical care paramedics who have extended skills. So they're advanced paramedics who would also be able to come and further stabilise or administer slightly stronger analgesias. So my colleague at the back is pumping the vacuum mattress up. So the vacuum mattress, it looks like a big bean bag basically, and there's a pump that will suck the air out of it. So I don't know if people saw these on the ambulances earlier, but they go off a little bit like concrete, so they just support the patient's body as well, very well basically. So the stroke victim is now on his way to the local A&E that has a stroke facility, which will be St Peter's from here. And the major trauma patient now is safely in the vehicle, and the trauma centre will be pre-alerted, and this patient will be taken to St George's, which is the nearest major trauma centre from here.
We'll do a hand over. Everyone's a winner. Is that us done? Done? Done.
Now I'm going to hand you over to the police officer who will let you know what the next stage is in the process.
Thank you. Now, once the casualties have been dealt with by the ambulance service, our next priority is to get the road open as quickly as possible. As many of you have probably experienced once in your driving career, I'm sure you've been held up in queues of traffic. So the traffic officers here are clearing way for a recovery truck to come in. As you can imagine, your simple AA is not going to be able to move a big bus like this, so we've got something rather special coming into the arena. Once the traffic car is now out the way, the recovery vehicle will reverse up to the bus. The bus cannot move, so it requires something this big to actually tow it out of the road.
Now, as the police officer said a little early, they do try and open the roads very quickly, and hopefully what the guys here and the ambulance service are hoping is that you get an insight to what they do, how they do it, and why they do certain things, because we all sit there in a traffic jam when something's gone horribly wrong, and we all wonder why it takes a long time to move past it. It obviously isn't helped in the main by a lot of people trying to look at what's going on, but an opportunity like this, you can see exactly how the emergency services deal with any particular incident and what they have. Police officer said a squash police officer is no use to the casualty at all, so that takes a little bit of time. You've got to secure the area. There may be a criminal prosecution, of course, arising out of it, so they have to make sure that any evidence is undisturbed and is gathered in a timely, proper manner. And the ambulance service must make the right decisions about the people who have been injured in any RTA. Say there's no accidents these days, it really is someone's fault at the time, and hopefully it's a little sobering when you watch something like this. It doesn't have to be bad driving, doesn't have to be very sudden work, can be something as simple as a heart attack or indeed a stroke. And we had a volunteer here who years ago was driving a minibus and actually had a heart attack at the wheel, managed to drive it safely off the road without injuring anybody on what was otherwise a very crowded street. So a very selfless act on his part. It's not always something that can be avoided, it can be a medical emergency. And of course, as they say, the big problem with these large vehicles when they're involved in an incident is actually getting them off the road. We're quite lucky here today because it's just a bus and we've got no fluids, but imagine if that were a tanker with chemicals on board that were particularly hazardous to health. Could be a gas, could be a liquid which would damage vehicles and people's health around the accident area. You might find then the police drafting in lots more people, going door to door, moving everybody out, or getting them to close their windows, have to do all sorts of things, and we, when we watch it, don't realise why. That's of course why all trucks have the nature of the fluids and gases on board listed on the side of the vehicle, because when these guys turn up, they've got to make a decision about what to do and what the particular hazards are. And the fastest way is just to look at the vehicle, which tells you whether it is hazardous or not, and then you can make your decision accordingly. It can be a thankless task. People drive past and sometimes look badly at these people, but they are doing a very fine job in making sure they lift these vehicles out of the way as quickly as possible. The other thing that follows on from that, of course, is with some of these accidents or RTAs, you get the surface of the road badly damaged, and of course roads will then need resurfacing, and in order for that surface to actually work, they will then need to leave it for a period of time. Okay, we need to give a big thank you to the police, the ambulance and the recovery team, so can we have a big Brooklands hand please for these guys? They had to swap around at the very last minute and put all together, so I think they've done an absolutely wonderful job. Okay, we will clear up here. We'll head back down to Arena 1 and we'll see what we can amuse you with until the rains come and before the close of play today. Okay, thank you very much, guys. We'll all be going back outside the clubhouse and we'll get something else going for you in a few minutes. Thank you very much.